Hello guys. My name is Ous. I am a fourth year medical student at the time of the recording of this video. And today I will be talking about heart. I think the question description of the heart, prenatal and postnatal circulation. Now, before I start, I just want to say when you have a question that's this broad, where you're talking about description of the heart as a whole, try to always be concise and don't go into so much details. Just say the basics about everything and you will know the details because you covered the other questions that go into details with each specific topic. So when it's such a broad topic such as this question, try to just say the basics, and if the professor in the exam wants to ask you about the details, then you should know them from the other questions. That's first. Second of all, is that try to always have a structure. Like for example, each question I'm going to start with the definition, and then I'm going to go into, I don't know, borders of the organ, then the surfaces, then and so on. So yeah, just keep that in mind as we go through this presentation. So first of all, as I mentioned, we start off with definition. Now, definition of a heart is pretty straightforward. It's a muscular organ found like in the middle of the mediastinum, and it's just responsible for like pumping blood to the rest of the body. Then moving on, we can talk about the structure of the heart wall. So we have like the base and the apex. This is, as you can see, this is like a very like how do I say this? Simple picture. But I mean that's one way to describe the structure of the wall, because you have the base, which is technically the posterior aspect of the heart, and as mentioned here, it's formed by mainly by the right atrium. Um, it faces vertebrae T6 to T9. However, it is separated from them by the pericardium and the oblique sinus, which I'll be talking about later, and the esophagus and the aorta. However, other than the base, we have the apex. Now, if you know anything about the apex, I think, and if you're seeing this video after summer dissections, then when you orient the heart, you should know that the apex is technically formed by the anterior-inferior aspect of the heart, and it's mainly formed by the left ventricle. And if I will be doing a video about making a video about the projection of the heart, and in that video I will mention that you can find the apex at the level of the fifth intercostal space, which is something that you might get asked about. It's very important to know that. So then you can go and talk about like the surfaces of the heart. Now I like this picture because it's simple and it makes it like easier to understand how does the heart how is it oriented inside of the body. And as you can tell here, it shows that there's the base, as I showed you, and the apex, but also there's the anterior surface, the diaphragmatic surface, and the left and the right pulmonary surfaces. So starting off with the anterior surface, you can also call it the sternocostal surface. It's directed forwards, and it's formed mainly by the right ventricle. And then we have the inferior surface, which you can also name the diaphragmatic surface. It's directed downwards, and it's formed mainly by the left ventricle. Then we have the left and the right pulmonary surfaces. The left is formed mainly by the left ventricle as well. However, the right is formed by you can say the right atria superiorly and the right ventricle inferiorly. So then we can go into the layers of the heart wall. This is like, you can say this is closer to histo. However, I'm pretty sure if I remember correctly, there were questions also about the endocardium and so on. So you will go into more details when you cover the other questions, which I think are covered by my colleagues in other videos. But in this question, it's just sufficient to like just say the basics. So start off with like the wall of the heart is made up of three different layers: the endocardium, the myocardium, and the epicardium. Now, one thing that might throw you off, for example, in this picture, we have the endocardium, the myocardium, and then it says visceral pericardium, and then there's a space and parietal pericardium. But keep in mind that in some places, such as this picture, it says visceral pericardium, but it's just another word for epicardium. So technically, it's endocardium, myocardium, epicardium, and then the space is called pericardial cavity, and then we have the parietal pericardium. So now how do I say this? Okay, so we can start off maybe with the endocardium. It's the most internal layer. It's a thin layer composed of like connective tissue, and you can say like simple squamous epithelium, also known as endothelium, and it lines the inner surface of the myocardium. And then we have the myocardium, which is the thickest layer of the heart, and actually the thickness of the myocardium varies according to where you are looking at it in the heart. For example, it's the thickest in the left ventricle, which makes sense because the left ventricle needs so much power to pump blood across the whole body, while the right ventricle, for example, only needs enough muscle to like or power to pump blood only to the lungs, which are pretty close. So that's why the left ventricle, the myocardium in the left ventricle would be thicker than the myocardium in the right ventricle. And then we can talk about the epicardium, which is like a thin external layer lining the outer surface of the myocardium. And it's formed by mesothelium, which is like a thin layer of connective tissue. And yeah, you can say that I think that covers like what's important for the wall of the heart. We have also like the pericardium, but there's a whole question about the pericardium that I think will be covered by my colleague, so I won't talk about it much. And then we have the sulci of the heart. So first of all, what's a sulcus, or like what are the sulci of the heart? In other words, you can just say grooves on its surfaces, okay? So how are they formed? It's formed by the divisions or the chambers of the heart. So you know how the heart is divided into four chambers, two atria, two ventricles. So these divisions end up forming grooves on the external surface of the heart. Now, sorry. Now, if you like the pictures that you are seeing from like the pictures that are similar to the picture that you are seeing now, I use it from the book. It's from the book Atlas of Themes, the 2016 what do they say? Edition, 2016 edition. Yeah. If you like, I'm just letting you know that if you like those pictures, then they are found in that book. I think that book is very helpful, so that's why I'm just recommending it. So, going on. So, we have four main sulci of the heart. In this slide, I'm going to talk about two. In the other slide, I'm gonna talk about the other two. Now, first one, we have the coronary sulcus. I highlighted the two sulci that I want to talk about in this picture. So, starting off with the coronary sulcus, it separates the atria and the ventricles, and it contains the right coronary artery, circumflex branch of the left coronary artery, small cardiac vein, and the coronary sinus. I won't go into details about the coronary arteries and cardiac veins because also they have their own question, but you should know them in case the professor asks any question. And knowing them obviously makes it way easier to understand why in each sulci you have those arteries and veins. Then we have the anterior interventricular sulcus, which you can see also in this picture. I'm pretty sure you can't see my mouse. However, in the anterior interventricular sulcus, which is found at the interventricular septum in between the right and the left ventricles on the anterior surface. And it contains the anterior interventricular branch of the left coronary artery, which makes perfect sense, and the great cardiac vein. Then we have the sulci of the other two that I was talking about. Now, unfortunately, I couldn't find a picture that shows the terminal sulcus, like a good picture, but I just wrote the description nonetheless, so maybe you can go back to it. So, but starting off, first of all, we have the posterior interventricular sulcus, which is like kind of like the opposite of the anterior interventricular sulcus, in which in this case it's found on the groove in like the posterior surface, also separating the left and the right ventricle. And in this case, if that one contained the anterior interventricular artery, then it only makes sense that this one contains the posterior interventricular coronary artery and the middle cardiac vein. So for anterior, we said great cardiac vein. For posterior, middle cardiac vein. And then we have the terminal sulcus, which is a groove that's close to the opening of the superior vena cava and the inferior vena cava. This one acts like as a border between the right atrial pectinate muscles and the sinus venerum, which I think will be discussed more in other videos. I'm not sure which video, like which of my colleagues is going to talk about it, but it should be covered in other videos. Now, then we have the pericardial sinuses. Also, should be like, I think in the video for the pericardium, they will talk more, they'll go into more details. However, in such a broad question, it's sufficient to just say that these are like passageways formed by like unique foldings of the pericardium around around the great vessels, because you know how that we have the visceral pericardium and the parietal pericardium, and the way they fold and so on can lead to some passageways forming. So we have the transverse and the oblique. So first of all, I'm going to talk about the transverse pericardial sinus. It's found superiorly on the heart, and actually the upper picture and the lower picture both show the transverse pericardial sinus. You can see how the doctor, or like in the illustration, you can see how you can put your finger behind the aorta and the pulmonary trunk, and that's what's known as a transverse pericardial sinus. If you see the picture below, it's more of like a transverse section, and also we have the pulmonary trunk and the aorta, and you can see how there's like a passageway, the red arrow, you can see how we have like a passageway behind them, and this is what's known as a transverse pericardial sinus. The oblique pericardial sinus is a blind ending passageway, so like there's no other way to describe it other than that, and it's located on the posterior surface of the heart. So it's not shown in the upper picture, and it was really hard finding a picture for it, but I think the one down shows it well, in which you can see that it's on the posterior surface at the end, even behind the left atrium. That's where you have the oblique sinus of the pericardium. And if the transverse pericardium, as you can see in the picture, he puts his finger like this, the oblique pericardium, you would put your fingers like this. So then we have the chambers of the heart. So I'm going to start off with the right and then to the left. So, sorry. So starting off with the right atrium, yeah. Sorry, 1 second, because the presentation is really small here. I have it opened on my other laptop so I can see the pictures bigger. So, okay, so starting off with the right atrium. So obviously, the right atrium receives the oxygenated blood from the superior vena cava and the inferior vena cava. Superior vena cava getting blood from the two brachiocephalic veins, from the subclavian and the internal jugular and the external jugular, so technically from the head and the upper limbs, while the inferior vena cava from the rest of the body, from the abdomen and the lower limbs. Okay, so that's where we get the oxygenated blood coming into the right atrium. And I in each picture I highlighted the structures that you need to talk about or you need to know. So we talk about superior and inferior vena cava, and then we have the interatrial septum, which is, as the name implies, interatrial. So it's in between the left and the right atria, and it's a septum in between them. Now, in the interatrial septum, we have what's known as the oval fossa. In the oval fossa, now, why is the oval fossa clinically significant? Because in the fetal circulation or the prenatal circulation, which is part of this question, which I'll be coming to later on, it was known as the oval foramen, not the oval fossa. Why? Because it was an opening. Actually, I'll go more into details when I'm talking about the prenatal circulation. But for now, all you need to know that the oval fossa is found in is found in the interatrial septum, and before being the oval fossa, it was the oval foramen, and you'll understand the significance of the oval foramen once I talk about the prenatal circulation, I think in like 2 slides or so on. Then we have the valve of the coronary sinus, where the cardiac veins drain into the right atrium. Into the right atrium. And then you can see also we have the right atrioventricular orifice with atrioventricular valve. So which valve do we have between the right atrium and the right ventricle? The tricuspid valve. Okay. So now the tricuspid valve has 3 valves: septal, anterior, and posterior. The reason this is important, because you see where the arrow is pointing, the right atrioventricular orifice with the ventricle, they're actually pointing at the septal valve. And this is important because although it doesn't show over here, but there's a triangle known as Koch's triangle, okay? And what forms the triangle is the inferior vena cava, okay? Or also you can say tendon of Tadaro. But for now, let's stick to the inferior vena cava to make things simpler. So inferior vena cava and the valve of the coronary sinus and the septal cusp, which I'm telling you that arrow is pointing at, those three form like a triangle, and in between them you can find the atrioventricular node or the AV node. So that's why the Koch's triangle is a very important structure, which I'm assuming also when they talk about the conducting system of the heart covered in another question by my colleague, they should mention that for you. Then we have the pectinate muscles and the terminal crest or crista terminalis. Pectinate muscles are like you can see them also if you're seeing this video after dissection, then I'm assuming your dissection demonstrator already showed you the pectinate muscles which are found in the atria, and it's just that yeah, they're type of muscles fibers that are found in the atria. And the terminal crest is technically where those muscle fibers end. So that's why you can see, and it's like a muscular ridge. That's why you can see there's like kind of like a ridge after those muscles, and that's where the terminal crest is found. Why is the terminal crest important? Because where the arrow is pointing, where the terminal crest is, if you close this atria, between the terminal crest would be very close to the superior vena cava. Between the superior vena cava and the terminal crest, that's where you will find the SA node, the sinoatrial node, which also should be covered in the conducting system of the heart. And lastly, the right auricle, which is like a sorry. Yeah, and lastly, we have the right auricle in which we have those muscles, and it's just like an extension of the right atrium. Then we would have the right ventricle. Now, obviously, the right ventricle receives the deoxygenated blood from the right atrium through the tricuspid valve, and then it pumps this deoxygenated blood to the lungs through the pulmonary valve into the pulmonary trunk. Now, we can divide what was it called? The right ventricle into an inflow and an outflow portion, okay, or tract. Now, let's start off with the inflow portion. The inflow portion is covered by like we can say like how do I say this? Like a group of muscular elevations known as the trabeculae carneae, which you can also see like actually they're like more of like three arrows pointing at what trabeculae carneae is, and we can group them into three types. Okay, so keep up with me. We have three types. We can call them like ridges, bridges, and the papillary muscles. So starting off with ridges. Ridges are technically just type of like muscles which are attached along their entire length on one side like to form ridges along the interior surface of the ventricle. Okay, so technically they are attached to the wall of the heart on their whole length. Okay, and if you don't understand what's that, you can understand it better when I explain what's bridges. So as I mentioned, we have ridges, bridges, and papillary muscles. Bridges are attached to the ventricles on both ends, but free in the middle. Okay, so in the middle, they're free. However, on both ends, they are attached. And those are known as the submarginal trabeculae, or also known as moderator band. You can see it's found under trabeculae carneae. It's highlighted under trabeculae carneae, and you can see how it's attached on both sides. However, in the middle, it's free. While ridges, it's attached on the whole, like it's not free at any part. Okay. And lastly, we have papillary muscles. Now, in the right ventricles, we have anterior, posterior, and septal papillary muscles. But why? Because they have to go hand by hand by the valves of the tricuspid. So in the tricuspid, we have the septal cusp, the anterior cusp, and the posterior cusp. So what are papillary muscles? Papillary muscles are muscles that are anchored on one end only, not on the other end. Remember, bridges on both ends, but free in the middle, while papillary muscles are anchored by their base to the ventricles. However, on the other side, on their apical side, they are attached to like fibrous cords, and those fibrous cords are known as the corda tendinae or tendinous cords. And these cords are attached to the cusps of the tricuspid valve. Why is the corda tendinae and the papillary muscles important? It's because when the papillary muscles contract, they prevent the prolapse of the valve leaflets. Okay, so like for example, when we have ventricular systole, okay, when the ventricles are like contracting, this increase in pressure can lead to the valves bulging out, okay, towards the right atrium, and that's not good. We don't want that to happen. So what the papillary muscles do is that they contract, pulling the corda tendinae, which pull the valves, which preventing from bulging upwards or opening. Okay, so that's what tendinous cords or chorda tendineae and the papillary muscles are, and you can also see them in the picture. I think, yeah, the septal papillary, posterior papillary, anterior papillary, and the tendinous cords are all highlighted and pointed out. So what else do I want to cover here? Oh, okay. Then, so that was the inflow portion or the inflow tract. Then we have the outflow portion, or also known as the conus arteriosus. Okay, the conus arteriosus, as you can see, so trabeculae carneae is where you have all the muscles, and it's very like, how do I say this? It's not a smooth surface. However, conus arteriosus, as you can see where the arrow points, it's like a smooth surface. And as I mentioned, it has no trabeculae carneae, and it leads, and that's the outflow tract where blood goes from the right ventricle to the pulmonary trunk. So it's just like the sorry, the tract that leads to the pulmonary artery. Now, two more things that I want to talk about. One, the supraventricular crest, which is, so what is the supraventricular crest? The supraventricular crest is technically like a line that divides the outflow tract from the inflow tract. Trabeculae carneae from the conus arteriosus. That's where you see the as you can see, the arrow where supraventricular crest is pointing. It's technically literally the line between the smooth surface and like the quote unquote rough surface, or where you have all the muscles and so on. Lastly, I want to talk about the interventricular septum, which is technically the septum that separates separates the right ventricle from the left ventricle, and it's composed of the superior membranous part and the inferior muscular part. So the interventricular septum, the upper part of it is like membranous, and the inferior part of it is muscular. So then we would have the left chambers of the heart. I have only one picture because that's the only picture in the book, but that's also because there's not much to say about like the left atrium. I'm sorry. So the left atrium, it receives oxygenated blood from the pulmonary veins. So superior vena cava, inferior vena cava get the oxygenated blood from the body to the right atrium. Then from the right atrium to the tricuspid valve to the right ventricle. Then from the right ventricle pumped to the pulmonary trunk, still deoxygenated blood going to the lungs, gets oxygenated, then comes back by pulmonary veins to the left atrium. Now, the left atrium then pumps blood through the atrioventricular orifice, in which we have the bicuspid valve, or also known as the Mitchell valve, into the left ventricle. What else? Also, we also have the left auricle, the same way we have the right auricle in the right atrium. And also, like you can also say that the inferior surface of the left atria can be divided into two parts. We have the inflow and the outflow portion. The inflow portion receives blood from the pulmonary veins, while the outflow portion is lined by the pectinate muscles, which also can be seen in the picture, and it's located anteriorly, and that's where the blood can go to the left ventricle. And then finally we have the left ventricle, which is obviously the part of the heart that has the thickest myocardium, as I mentioned earlier, because that's where you need like greater power to pump blood to the rest of the body. So the left ventricle, it receives oxygenated blood from the left atrium through the mitral valve, and then it pumps blood through the aortic orifice, in which we have the aortic valve, and also can be divided into an inflow and an outflow portion. Inflow portion also has trabeculae carneae, and we have only two papillary muscles. Remember in the what was it called? The right ventricle, we had anterior, posterior, and septal, while here we have only the anterior and posterior for the mitral valve, mitral cusps of the mitral valve. And then we have the outflow portion, which has no trabeculae carneae. Honestly, that would be it for the chambers. Then prenatal and the postnatal circulations. Now, the question says description of the heart, which is extremely broad. However, prenatal and postnatal circulation are specific topics. So that's where you want to go into details. That's where you would expect to be asked detailed questions if you pick this question. Like, chances are you are not gonna be asked about the I don't know, the pericardium a lot in this question because it's very broad. But if you pick the pericardium question, then you will definitely be asked about the pericardium a lot. Similar case when you're talking about the prenatal and the postnatal circulation. This is the only question I think that covers these topics. So here you have to know the details very well for this question. So, sorry. So, starting off with the placenta for the prenatal circulation. Now, obviously, there are differences between the prenatal and the postnatal circulation. Why? Because the fetus doesn't breathe on their own. They need oxygen from the mother. They need nutrients from the mother. And that's why, since they don't need the lungs, then they need to like, how do I say this? Bypass, maybe that would be a good word, like to bypass the lungs because they don't need them and they're collapsed anyways, they can't breathe. So starting off with the placenta is the organ that connects the fetus to the wall of the mother's uterus, and that's where like they will have like the exchange of oxygen and nutrients and so on. So first of all, you can see that we have blood from the placenta, which is like to go into more detail, it's not 100% oxygenated, it's like 80% oxygenated. It flows through the umbilical veins. Okay, now we know that arteries usually have the oxygenated blood and the veins usually have the deoxygenated blood. But in this case, the umbilical veins which are the ones that have the what was it called? Oxygenated blood, because they're traveling back to the heart. That's why we call them veins in this case. And yeah, so the most of the blood, it bypasses the liver through the umbilical veins, and you can see in the picture we have the umbilical veins, and then we have the ductus venosus. Okay, the ductus venosus, it connects straight into the inferior vena cava, bypassing the liver. Okay, so most of the blood travels from the placenta through the umbilical veins, through the ductus venosus to the inferior vena cava, bypassing the liver. However, there is a small amount of blood that, as you can see, there is a small connection. The arrow says anastomosis between umbilical vein and portal vein. So there is a small amount of blood that goes through the liver. However, most of it actually bypasses the liver and goes through the ductus venosus. Then, in the inferior vena cava, blood from the placenta, which is oxygenated, mixes with deoxygenated fetal blood returning from the limbs. So you can see how like the inferior vena cava, under the connection between the umbilical vein and the inferior vena cava, the inferior vena cava is originally like blue. However, once it connects with the umbilical vein, it turns purple. And that's because we had the red oxygenated blood with the blue unoxygenated blood mixing together. That's why it shows purple here, because we have oxygenated and unoxygenated blood mixing together. Then the inferior vena cava obviously drains into the right atrium. Now, here's where it gets interesting. Remember the oval fossa that I was talking about at the beginning? And I told you that I'll talk about it later because it's clinically significant in the prenatal circulation. That's because the oval fossa in the fetus is known as the oval foramen. It's not a fossa, it's an opening. Okay? Why? Because since we don't need the lungs, since the blood's already oxygenated by the mother, we don't need the blood to go to the lungs. We need it to go straight into the rest of the body. So what happens is that the blood flows from the right atrium into the oval foramen, into the left atrium, into the left ventricle, and then gets pumped to the rest of the body. Like, we don't need the lungs, thus the blood doesn't need to go to the right ventricle in the first place and go and gets pumped back to the what's it called? To the lungs and then back to the left atrium. No, it skips the lungs, it skips the right ventricle and goes straight through the oval foramen into the what was it called? Into the left atrium. To go into a bit more details, a small amount of blood is prevented from entering the oval foramen through what's known as crista dividends, dividends, and it's technically the lower edge of septum secundum. I'm assuming in the embryology of the heart, my colleague is covering this question, and she should be talking about septum secundum, so you'd understand what crista dividends is. Then, as I mentioned earlier, once in the left atrium, the blood travels into the left ventricle and then gets pumped by the left ventricle into the systemic circulation, as you can see here in the picture. Now, deoxygenated blood, it travels back into the placenta via the umbilical arteries. You can see at the bottom of the pictures of the picture, the blood is traveling back through the umbilical arteries back to the placenta to be oxygenated by the mother. Now, some oxygenated blood from the right atria may enter the right ventricle, as I mentioned earlier. And if it enters the right ventricle, it gets pumped into the pulmonary arteries. But as I mentioned, the lungs are collapsed and the fetus cannot breathe. So how does the blood go from there into the aorta? And you can just say it goes through the ductus arteriosus. You can see in the picture in between the pulmonary trunk, pulmonary. Yeah, it doesn't show it much. There is an arrow, like yeah, there is an arrow showing ductus arteriosus, and it shows that the pulmonary trunk and the aorta are connecting. However, it's not really the case. They don't like connect. They're not one artery, but there is like a small connection in between them. They don't form one artery together, but there's one connection between them. But this picture is just to make things simpler for you. Okay, so that's what ductus arteriosus is. And the reason it says patent in between is because it's open. And this is how the lung, like they bypass the lungs. Now, that's it for the prenatal circulation. Keep in mind ductus venosus, actually placenta. Then we have umbilical veins which carry the oxygenated blood. Then ductus venosus to bypass the liver. Inferior vena cava has deoxygenated and oxygenated blood, oxygenated from the placenta, deoxygenated from the rest of the body. Then into the inferior vena cava, into the oval foramen, into the left atrium, left ventricle, gets pumped to the rest of the body, then by umbilical arteries back to the placenta. And whatever goes to the right ventricle and into the pulmonary trunk goes again to the aorta via the ductus arteriosus. Now, lastly, we have what's known as the postnatal circulation. Now, what is postnatal circulation? It's a circulation that we all have right now. So obviously, there are some changes between the fetal circulation and the postnatal circulation. The changes that occur are caused by the cessation of placental blood flow and the beginning of respiration. So when the baby gets born, starts crying, their lungs open up and they start breathing, and also there would be no placental blood flow would stop, especially after it gets cut by the doctors. So in the fetal circulation, the right side of the heart has higher pressure than the left side of the heart. Okay, this difference in the pressure allows the shunts to remain open. Okay, so that was in the prenatal circulation. Okay, however, now there are, as I mentioned, there are some changes in the postnatal circulation. In the postnatal circulation, you can see those changes happening in the picture. First of all, starting off with the ductus arteriosus, you can see up above in the picture, it says ligamentum arteriosum. So ductus arteriosus forms what's known as ligamentum arteriosum in us adults, in the adults, okay? How does it form? The ductus arteriosus closes via like muscular contraction of its wall. The muscular contraction is mediated by bradykinin produced by the lungs. However, I don't know if you need to know this as like first-year medical students for your anatomy exam. And then this causes the amount of blood flowing through the lungs to increase rapidly, and this increases the pressure in the left atrium. You get me? So the ductus arteriosus closes, okay? And this causes the amount of blood to flow now to the lungs since the ductus arteriosus closed. And since the blood is flowing into the lungs, this increases the pressure in the left atrium because now the blood has to go back to the left atrium through the pulmonary veins. And simultaneously, we also have pressure in the right atrium decreases. Why? Because of cessation of the flow of the placental blood. So since the right atrium pressure decreases, this leads to the flap, like the valve of the foramen ovale. Remember how we said we have foramen ovale and then we have a valve in the left atrium. The decrease in the pressure leads to the closure of this valve, and that's how later on we have the oval fossa in the postnatal heart or like the adult heart. Then, in this case, the right ventricle then pumps blood through the pulmonary arteries into the lungs, and then blood from the left ventricle is pumped through the aorta and distributed to all regions of the rest of the body. Lastly, we have also the difference between the umbilical arteries and the umbilical veins. So the umbilical arteries, they also close. However, the distal parts of them, the distal part of the umbilical artery forms the medial umbilical ligaments. However, the proximal parts remain open. They don't close, and they form what's known as the superior vesical arteries. That's it for the umbilical arteries. However, the umbilical veins, they close, okay? And also closure of ductus venosus close as well. However, the umbilical veins form what's known as the ligamentum teres of the liver, and the ductus venosus forms the ligamentum venosum. So, one last time, just to like summarize everything. Ductus arteriosus closes, forms ligamentum arteriosus. And then the oval foramen, the valve closes, and it forms oval fossa. Umbilical arteries, distally, they also close. They form what's known as the medial umbilical ligament. And proximally, they stay open and they form what's known as the superior vesical arteries. And the umbilical veins and ductus arteriosus also close. Umbilical veins form the ligamentum teres of the liver, while the ductus venosus form the ligamentum venosum. That being said, that's it for me. Thank you guys. I hope you learned something. Bye.